anyone pernah terpicuk lutut and all the ankles? So that is what ligaments and it does to the ankles and the knee. So when you pop your knee, you tear a ligament. Ligament tadi boleh tear, so that means tarik. So ada grade-nya, ada grade 1, grade 2, grade 3, boleh tarik dengan habis or partial tear. So the famous one is the knee injury. Banyak footballers, netballers, basketballers as well injure the knee. So that's called the anterior cruciate ligament, ACL. If you know Ronaldo, so Ronaldo has injured his ACL. So it's a very detrimental effect to the human body because the human body, as you know, is you're carrying like maybe 60-70 kilos, and when you bertumpu ni bermakna putting a lot of pressure on just your knee, and it gives way. So that is how major injuries happen, because you're carrying a lot of weight and suddenly you twist and you terpicuk, and that's how your ligaments get torn. Alright? So that's ligaments for you. Tendons is tough cords of attaches muscles to bones. So muscles to bones is called tendon. The famous one is the Achilles tendon. Anyone know what the Achilles tendon is?
Troy.
On your heel, Troy, yeah. Troy. Brad Pitt, have you seen that movie? How he got injured because of bow and arrow hit his Achilles. So that's how the famous Troy fell. So Achilles tendon is very, very sensitive for the human body when it ruptures, because it's a very tough cord. It's very keras, this Achilles tendon. You can feel it if you feel your heel. That yang keras tu, it's not tulang, it's a tendon. So that tendon is very, very powerful, and once it snaps, there is I think 15 or 10% chance of it recovery. So I had a coach once. He was from Czechoslovakia, Coach Vlad. He ran the. He was an athlete, a sprinter, and then now he's over the hill already. So he ran just a normal 400 meters, and suddenly he tore his Achilles heel, and he fell. He could not get up at all. So that's how powerful the Achilles tendon is for the human body. So that's tendons. So muscles to bones is tendons. Cartilage, on the other hand, cartilage. Pernah dengar cartilage? So this is what we call the shock absorber. I call this the shock absorber. So in between tulang-tulang kamu will have cartilage. That means shock absorbers. Kalau kita, the shock absorber, it has gas and oil. So this cartilage acts as a substance, a liquid substance, a liquid fibrous substance in the knees. So it's famous in the knees, joints here, right? So especially in the knees. Kalau orang yang already approaching the 50s or 60s, there will be a decrease in cartilage, because as we get older, everything in our system gets decreased lower. So cartilage is what I call the shock absorber. Right? So just imagine your knee, your tulang, and then your knee here. Usually there's something in between. So whenever you do a movement, there's cushion. It never meets. But once the cartilage is gone, your knee will hit each other. So the presence of knee loop is very evident. So that's how cartilage, the decrease in cartilage happens. Last one is menisci. So meniscus is very famous among footballers. So when you tear your meniscus, it's a mixture of ligaments, torn ligament or menisci. Just a show of hands, siapa yang pernah terpicuk lutut? It's a really important lutut injuries. Hands up. There's one there, two there, three there. Football injury. Anyone else? Football injury? Anyone else? So the most The most common ones are football injuries for ligaments, maybe netball. Okay, so these are pictures of what ligaments are. So bone to bone, this would probably be the humerus and part of the ulnar radius. So this is the muscle here, the red one is muscle. So this green one, so the yellow one, okay, it connects from bone to bone, that's called the ligament. It acts as a ligament. Itulah dinamakan ligament. Next one, muscle to bone. So this muscle here, and then this bone here. So this really tough is called the tendon. It's actually very, very tough. Not as tender as a ligament. Ligaments are actually much more tender. Tender meaning soft, lembut daripada tendons. Tendons are much more tougher than ligaments. So an Achilles tendon tear or rupture is very rare. Adalah sangat jarang berlaku. Last one, cartilage, the green one. That's shock absorbers. I call it shock absorbers. It helps me think that once it's gone, your tulang will meet each other and you have always this excruciating pain. Yang kalau orang tua and have to use the cane and some jalan. So that's what happens here. Yeah. Understand ligaments, understand tendons, understand cartilage. Any more questions? Everyone happy? Just an example of Achilles tendon right here. So this is the heel. Here is the foot. So this right here, muscle to bone, is Achilles. So imagine if this tore, sekiranya ni putus. So a huge amount of your muscle will be putting on nothing, akan bersandarkan pada nothing at all. So it's very, very painful if you have an Achilles tendon. Alright. This, on the other hand, is the anterior cruciate ligament. Okay. So this one here is a ligament tear. Alright. So probably orang-orang yang lututnya yang pernah terpacul atau terselio, alright, it's actually ligament tear, tapi kita tidak tahu which one it is. So it could be anterior cruciate, posterior cruciate, or lateral or medial cruciate, which means kanan, kiri, belakang, depan. So yang famous is anterior cruciate ligament. Alright, types of movements that we have to know dalam science kita is all this: extension, flexion, abduction, adduction, rotation, and circumduction. Not circumcision, circumduction. Extension, when the joint straighten in its natural position to its full extent. So when you straighten your knee, that's called an extension. Flexion, joint bent so that one of the bones moves towards the other. Right? So the bone here meet each other. This bone wants to meet this one. That's called flexion. Abduction, movement away from the center line. So the human body, the center line will be here, garisan tengah. So away will be abduction. Anything away, abduction. Adduction is the opposite. Right. Rotation is easy. Anything that rotates, okay, lateral, right, or medial rotation. And last one, circumduction. Anything that makes a circle, yang membuat bulatan, will be circumduction. It's just basic terms that level 1 sports science has to know for anatomy. It's quite tedious, but something we have to know. Alright, now we come to muscles, alright? Favorite part. So there's 3 types of muscles that we have to know: involuntary, voluntary, and cardiac. Involuntary, your blood vessels and your intestines, large and small. Voluntary, the muscles yang ada di dalam tumit, yang sedia kala ada. Cardiac